Oh, you're wondering, huh? Well, from their Robin boxes for packaging to their 148 life-saving commodities that they supply to posts across the country, well, that is what Zipline has been doing in Ghana. I had the opportunity of visiting their smallest facility in the Eastern region, actually nationally, but it's situated in the Eastern region in Omenako. Well, this morning, we have the pleasure of hosting Samuel Ekufo, Country Operations Lead, Zipline Ghana. Good morning.
Good morning.
Good to have you on the show.
Good to be here.
You know, until I went to the facility sometime late last month, I'd read a bit about Zipline. I had some fond memories in terms of what you did in the health value chain. But then I went to the facility and my mind was blown.
Yeah.
Everything that the cutting edge technology
Yes.
was what really got me. But tell us, you've been in operation for 4 years. You started in Rwanda, you came to Ghana, now you have posts in the Ivory Coast, Kenya as well, Nigeria too.
Yeah.
Tell us about the 4 years you've been in Ghana.
Yeah.
What has it been like so far?
So it's been 4 amazing years since we started in 2019 April. So we're just 4 years now. We started with our first distribution center at Omenako, where I remember on the first day we did just like 2 deliveries. And in the first month we did about 50 deliveries in the first month. And we are in that area. We were serving the Eastern region, as well as other facilities in the Afram Plains and other areas that are very hard to reach. But in the last 4 years, we've been able to successfully scale our operations from just 1 distribution center to 6, which is covering different portions of the country.
Where are they located? We know of the one in Omenako.
Yes, so there's a second one at around Ashanti Mampong in a town called Impenya.
Okay.
There's a third one around the Wale Wale area in a small town called Vopsi. Okay. And then there's one in Seshriyoso in the Western North region. There's one in Enum, which is close to the Volta side. And then there's one in Oti region to cover the Oti portion. So we have 6 now. And in a week, we are doing an average of about 4,000 deliveries across all these distribution centers. And in the last 4 years since we started operations, we've done over 360,000 deliveries.
360,000?
Yes, 360,000. And counting, because even as we are speaking now, I'm sure there are
deliveries are being
made. Zips in the air, yeah. And we've been working in collaboration with the Ministry of Health and the Ghana Health Service to serve the people of Ghana. We are currently covering about 2,500 health facilities. And these are hospitals, health centers, CHIPS compounds. And it's been amazing. We've been able to support the system. Our place here is mainly to support the supply chain, and we've delivered all kinds of things, ranging from blood. I can say we've delivered about 12,000 units of blood since we started operations. We've delivered, even with COVID, during the COVID era, we supported the Ministry of Health and the Ghana Health Service in delivering a lot of COVID vaccines to help us be able to achieve herd immunity. We've delivered about 2.1 million doses of those COVID vaccines. And then when it comes to the routine vaccines for children, immunization vaccines as well, we've done about 9 million doses.
Yeah, I know. Last time we came from rubella to all the other childhood diseases.
Yes, we've done about 9 million of those. Then when it comes to medical products as well, we've done about 1.5 million units of medical products. So we've done quite a lot in the last 4 years. We've also had very good impact. Especially when it comes to vaccinations and emergency situations where people need blood urgently. There are lots of impact stories that we can share. We, along the line, also did what you call like an impact study, collaboration with the Bill and Melinda Gates Foundation with the Ministry of Health and Ghana Health Service, where it came out that facilities that are served, that Zipline serves, right, have a 60% chance of having a shorter period of not having stock out periods, 60% shorter, because Zipline would be able to support those facilities. And a patient who goes to a facility that's served by Zipline is about 40% less likely to not get their shot. Because if they are located in a hard-to-reach area where ground logistics is unable to go to, or in an island somewhere, or in a mountainous area, that would not prevent them from having the dose, because Zipline would work with the Ghana Health Service and the Ministry of Health to make sure that we can fly to those locations and deliver to those hard-to-reach communities.
So from my visit there, and it's quite a system you have, rigorous system. Yes. I hear when the president came there, because that was the first outpost, the same processes we went through, he had to go through the sanitizing, the donning of all those materials. So quite a very high technology outfit. 65 to 70% of health posts are reached by Zipline across the country.
65%. Our coverage in the country is about 65%.
65%.
Yeah. There's still parts of the country that we don't reach yet, but we are hoping that in the next few years we can have distribution centers that cover those areas. So
we'll talk about what futuristically you're going to do so that you can maybe at a point have full coverage of the country. I'm sure that is the projection. But it appears within a short space of time, you have achieved so much. Like I said, I came to your facility and I was astounded by the technology, cutting edge technology. Your drones cost in the millions of dollars. I was surprised. The fiber covering and everything and how efficient they are. But how have you arrived at this success? What did it take to get here?
I think one of our main values is continuous improvement. So we don't sit on our laurels and just assume that we are the leading company in terms of aerial logistics in the world, which we are. But we try as much as possible to make sure that we are continuously improving. The main part of our success has been the people we hire, right? And I'm sure you saw only Ghanaians on the premises. This is a fully run operations by a Ghanaian team. I'm a Ghanaian. Our general manager is Ghanaian. And
I even saw national service personnel and all of that.
Yes.
And you have a training post where people who come in are given rigorous training.
Yes, and so we have the talent in Ghana. So we try to recruit really well, because we believe that if you hire the right people, they will always be able to come up with ideas. A lot of the things that helped us improve, be able to scale, were ideas that came from the teams that we had. Because what we are doing is basically something that doesn't really exist in the world, because it's a novel technology, right? And so it requires that you are continuously thinking about the problems and how to solve it and how to integrate. Most of the time, people see the drone and be like, oh, this is a drone company. But if you look at it critically, we are also like we are a logistics company. And to be able to succeed in healthcare space, you have to integrate your services into the healthcare terrain. And the integration bit is what we've been doing for the last 4 years, working with the Ghana Health Service, letting people understand how the service works, how we can fit into the supply chain. So there's been a lot of legwork to be able to get us to be an integral part of the healthcare supply chain within the areas that we serve. And I think there's been a lot of collaboration from the government and the Ghana Health Service in that regard.
And so in terms of, if you had to salute or look at those who have contributed to your success, what would you say?
Oh, the Ghana Health Service has been really instrumental. And all its other agencies, the Ministry of Health, expanded program on immunization, the National Blood Service, they've all been very instrumental in our success, because we operate in a way where we don't try to distort the system that you have. We try to work with it and integrate, right? And so we always have there's a feedback loop where we propose something, they propose something, we work together to make sure it works, because the patient is at the center of what we are doing, right? And so it's been amazing working with them.
Tell us about the cycle of your system. Not everyone has had the opportunity to go to a facility, an outpost like yours. I'm sure not anybody can just walk in. It's not possible. But I have been there, and the technology, right from the entry point to the facilities, to the equipment you have, to the drones and how they are caught, the precision. Walk us through what it is like, right from your storage facility where you store medicine, blood, plasma. What is it like? Tell us about your operation.
So the whole process starts with us identifying where the health facilities are located within an 80-kilometer radius, because that's how far the drone can go. Nowadays, it can even go 90 kilometers. So that's 90 kilometers in and 90 kilometers back. So we try to let the health facilities help us know where they would want the package to be dropped, right? So they just identify that location. We take the GPS coordinates of all those locations, and then we feed that into our system. And then we build a route from the distribution center all the way to the location where we drop the package for every single health facility. And then we also go ahead to share the routes with our regulators, which is the Ghana Civil Aviation Authority, for approval. And then if there are any issues, we handle that. And then once that is done, we onboard the health facilities, give them training, help them understand what to expect when a drone comes to your location. I'm assuming that if this is the first time a drone is coming to your location, it's like, what is this? So we onboard them. And then we work with the suppliers, which is National Blood Service, the regional medical stores, to get the stocks into our distribution center, to the warehouse where you saw the products. So that's where that's the operations we call the fulfillment operations, which is where we fulfill the orders. So an order comes from a health facility. So it's not a case where any random person can call us to place an order. No, it has to come from a health facility that's recognized and with a designated person. They call, we verify the order, and then we process it. And then it goes into the flight operations area, where we have the teams that manage the drones and the launch of the drones and everything. So they down put the package into the belly of the drone, then they launched it to the location. These drones are unmanned, so there's no one controlling it. Yeah. It goes to the location on its own, and then it delivers the package, and then it comes back to the distribution center, it's recovered. So we do that a number of times in the day. So that's the process. So once it's delivered, we now share reports and all the other things, that's data with our stakeholders, letting them know the deliveries that we've done and all that. So that's the end-to-end, how it looks generally.
And I would just say this for those who are watching us. The system is so precise that if, for example, for a chips compound or some facility, it is supposed to be dropped at this point, which is point X. 100 out of 100 times it will drop at point X, unless some extenuating circumstances like a force of nature or something happens and the drone is impacted. Yeah. That is quite some precision. But when I came to the facility, I noted that mapping was ongoing. We went to this other room, the last end, for other posts that are coming up, so that these same procedures will be followed. But the health posts, I don't know whether you have interactions with some of them from time to time. What have their reactions been? Beyond what you told me about what it means to rural communities, what have the reactions of the health posts been to your work?
So based on the study that we did as well, 9 out of 10 health workers are amazed with our service, and they are very confident that we are delivering value for them. A lot of them are very excited, especially those who are in the very hard to reach areas. I've been to Afram Plains where in engaging some of the health workers, they told me that sometimes it takes about 12 trips on the lake, right, in a month to be able to get vaccines from one point to the other, right? So if all of a sudden they have to just place a phone call or send an SMS or send a WhatsApp message and get the delivery done right at their doorstep, it saves them a lot of time, it saves them the risk on the water, it gives them a lot more time to be able to take care of the patients that they are working with. So from the side of the health facilities and the health workers, they really love what we've been doing. We also take a lot of feedback from them to improve our system, because there are also things, even though we provide a very precise kind of service where the delivery has that high level of precision, we are not perfect yet, right? There are still a few issues here and there that the customers would always let us know. We take the feedback and then we build it into our process and then we improve. So for those who were with us right from the beginning in 2019, they will tell you a lot has changed. Even from the way we do our things, we've gotten better over time.
More efficient, more effective.
Even way more efficient, right? And so that's generally the culture that we have. We take feedback from them, we improve. So it's been good with them so far.
Zipline is here to stay.
Yes.
Obviously. Yeah. But after all the successes you have chalked and in your supply of medicine, what are you looking at beyond medicine delivery? Are there other prospects for Zipline? And then you can also tell us about other areas you're targeting. Like we said, you would want 100% coverage. What other outposts are you looking at?
So if all goes well, in the next few years, we should be able to have coverage in a few more other locations. We currently don't have coverage in the Upper West side, as well as the Bronga-Hafo area.
You have only one outpost there, right?
We have that area. That one is in Upper East. So on the western side, we don't have anything there. So hopefully, if all goes well, we would be looking to have some on that in those locations as well. That will give us a lot more coverage to be able to serve a lot more people. I don't know if you saw in the media, but recently we launched a new platform of our drone, which is more focused on urban deliveries, which is, it seems very futuristic, but eventually in a few years you should be able to have a delivery done to your home. If you have a mother who is bedridden or is unable to move to go to the hospital for her cancer medication or for some medication, she can have it delivered
right at her
home. Yes. So in the next few years, we should expect seeing some of these things. We are also in discussions to. We're already delivering human vaccines, right? But there's a lot of value in doing other kinds of vaccines like animal vaccines. Our colleagues in Rwanda are doing a lot with animal health.
Yeah, so I heard.
Because the system can still deliver to farms, and so that the same logistics problem that exists in healthcare also exists in the agro space, where hard to reach locations, not getting the cold chain products to them on time and all of that. So we're also exploring opportunities in the agro space as well. So those are some of the things that Ghanaians should look out for. But we are still fully committed to doing and even better with what we are doing in the healthcare space, based on the collaboration we have with the Ministry of Health and the Ghana Health Service. Yeah.
All right. So to cap off the conversation, while I take your final words, what are the collaborations you're looking forward to? If any citizen, for example, is curious about what you do and how maybe they can contribute, so to speak, to make the system better, what are the avenues available and what next for Zipline? So
already we have a team we call the community team that is integrated into our operations in a way that they face off with the communities that we serve. And so we do a lot of activities in the communities with corporate organizations, partnerships and all that. And so we are very much open to any organization that just wants to know about our service. Even you mentioned that it's not anybody who can go there, but you can always let us know that you want to see it.
I mean, the right permissions have.
Yeah, exactly. But it's basically open. We open it up for students as well to come and see what technology can do, and also be able to dream and know that. I mean, if you are in your class taking your engineering sessions and all that, that is what technology can do. So we open it up for students to come and see what we are doing as well. We organize blood drives with the National Blood Service to be able to get a lot of blood units. That was some other collaboration or partnership that we do there as well. So we are very much open to engage all other stakeholders who have an interest in what we do. Our doors are always open. Yeah, you can always reach out to us.
Well, thank you very much, Mr. Akufu, for joining us this morning.
You're welcome.
And with all the good work you're doing, we can only hope and pray that you continue doing that and continue impacting lives. Thank you so much for coming.